Okay, so we have begun the recording. So the main thing for this meeting was mostly a Q&A in regards to how you manage your different professions or your different sources of income while you're still a PT student.
Mhm.
So I guess my big question for you, since I guess I'll kick it off, is how have your other jobs, your CSCS and your massage therapy licensing, how have those contributed to your curriculum, if it's on a big or small scale?
That's a good question. So with massage therapy specifically, surprisingly, it's actually helped me a lot, in terms of when I was in my second year of physical therapy school. We were taking a lot of anatomy, physiology, just like the bare bones type of things. And being a massage therapist, I was able to like pretty much study on the job, since I'm basically doing my palpation skills, running through all the muscles, like while I was like massaging somebody, like in my head, I'd just be like, all right, this is upper traps, this is middle traps. So it was really supplementary to my learning as I went through school. One thing I learned with massage is that it's very flexible. Like you could work 6 hours a week if you'd like, and they wouldn't, blink an eye or anything or bat an eye, because that's the general trend of how massage therapists use their scheduling. So if it was any other job, if it was like doing a cashier or anything like that, I think it'd be a lot harder to manage for myself, and just for my free time. But thankfully with massage, that's where I've been able to get that side income while still practicing and studying for PT. For the CSCS, it's been more of a supplementary learning for some classes, and with clinicals, just being able to dose exercises correctly and pretty much cue form in the best way possible in like a coaching aspect. But for jobs for the CSCS, I think for me, I'd put that on more of a hold, since that would require more of a time commitment.
All right, thank you. Who else has questions?
I have a question about the CSCS. So how much do you think, like in your opinion, doing the exercise science major here at Cal State Long Beach, how helpful was that for preparing for taking the CSCS exam? Because I've heard it's pretty intense and it's a lot of information.
Yeah, it's a good question. So with the CSCS, being an exercise science major, there's actually a class, I think it's like 483. I know Nathan's taking the class right now. That's kind of close to the curriculum for the CSCS. Can you like remind me what that class is, Nathan?
KIN 462.
462, yeah. So that class specifically, they really dive into the entire book of what you need to learn for the CSCS. The only things that they didn't really run through was basically like if you're going to be owning a gym, what type of like logistics do you need to follow, if, like how high the mirror has to be. So besides that, if you actually pay attention to 462, because in general that class is pretty easy, but if you really want to use it to your advantage and take the CSCS right afterwards, like that class would be super beneficial. It just takes a little bit more supplementary learning, maybe with like those like quiz apps, just to make sure you have all those little tiny portions of what the CSCS can be. That'd be definitely helpful. So I'd say it really has helped me when I was taking that CSCS exam.
Okay, cool. Thank you. I guess another question I would have was for the getting your license for the massage therapy, how intense was that, and like where did you go to get it done? Because I've seen that there's a lot of different schools that are very different requirements and stuff like that.
Yeah, so massage therapy, it's kind of weird because like the amount of money that you need to go into that schooling, it varies so much. Like it could be from like 2K for the entire like program to even 14K, which is nuts, because it's like, what makes that price difference so beneficial of going like, somewhere that is so high priced versus one that's low priced. I went for the cheaper option, and because I really think even if you put money into it, Like it really just depends on how you present yourself and what you practice and who you know. And so with my program, it was an 8-month program. So right after I graduated from my undergrad, I had about 8 months until I started PT school. So if I made it to PT school or not, like I used that time to make sure that I have a little bit of a backup, just in case. And so massage therapy was very easy, with our background in kinesiology, like our anatomy classes, physiology classes. Basically, the only thing I didn't know was the techniques of like Swedish and all the different ranges of massages. And that was basically just hands-on learning.
So how much do those different techniques that you learned from the massage therapy program, how much does that come into play when you're doing any treatments with the patient?
Good question. So depending on the setting, so my first clinical was an outpatient ortho, and a lot of my deep tissue skills came in handy, like so much so that I was actually teaching my PT and the other PTs in the clinic specific techniques of how they can save their hands, making sure their body mechanics were pretty good. So in that setting, specifically with outpatient ortho, it comes in really clutch just to make sure that they know what muscles are going to be hitting. Like usually if they have some sort of injury, tightness does build up because of there's either pain, some sort of compensation. And so that setting specifically helped a lot. Right now I'm an outpatient neuro. And so with that setting, a lot of people come with dizziness, and with dizziness, people get really rigid and they don't really want to move. And so with that, those muscles also still can get really tight. But more of that is just more patient education. But being able to leverage that you are a massage therapist really comes in handy when you're trying to have them do exercises, just so they know, like if they go too hard, they know like, oh, at least I get a little bit of a reward as a massage or something. So it's a really good tool for me to bring up if I have like difficult patients, or if I have patients that have really tight muscles that exercise would be beneficial, and then to support it would be a little bit of that soft tissue.
And I just came up with a question. Since you talked about the cueing and anatomy when relating to strength and conditioning and massage, I'm wondering, have you found a similar like collaborative effort for clients in PT that you have found in like massage and strength and conditioning? Like, is there more open room for open discussion when it comes to treatment or program types between the therapies and coaching?
Yeah, like all three of those realms, like my end goal is to like try to tie those in together anywhere I go. So with massage, like even when I'm at the Beach Balance Center, even with my patients or my clients, I'm just like, yeah, like these massages are going to help, but I always endorse them to exercise a little more. Sometimes I'll, show them an exercise after they get out of the room, just because I know how much benefit you would get, because if you like just do the massage and then add on with some exercise, like, I mean, they might not come back because they're not hurting anymore, but like my total goal is for them to just be self-sufficient. So there's a lot of room for the intertwining of the three realms. It just depends on how much you'd want to encourage your patients or your clients to work out, and how it will help with massage.
Cool.
With Long Beach's program in particular, how much free time would you say you have for doing actual work outside of school?
It depends. So basically, you could, it depends on what type of study you are. If you're a type A and you're like, I need to study all day, every day, just to make sure I get these, points in line in my head, and like just absorb all the information I can so I can get A's on the exams, you'll probably have no free time whatsoever to do anything besides studying. And, there was a lot of students in my cohort that were like that. And, burnout is usually around the corner when that happens. And so with grad school, you really have to, make sure that when you can stop studying, and when you can feel confident enough to be like, I think I can just pass with how I'm doing now. It comes with time with how you study. So basically, always keep trying different study techniques or like learning, like if you're an audible learner versus a visual learner, like use a mix and match of all three of those things or all of the other types of learning that you can do, just because it could cut down on time. Like in the beginning of PT school, I was like, oh, I'm definitely like a kinesthetic learner. And so I would like write out all my notes, like totally like, and that would take me like 4 hours just to do and be like, okay, like since I wrote it out, I think I've absorbed it. And I was getting the grades I needed for PT school, but I was, in a hole of time just to make sure I can write out all those notes without, cramping my hand. And then my second year, I started transitioning to more of a auditory learner, and that cut my time for studying to like 2 hours a day. Just because I found out that I was actually more of an auditory learner. And like if I just listened to my notes over and over and over again, I could like set a specific amount of time for that little bite of information and then just carry on throughout my day, or even like go on the treadmill and just, study that way. And so you just got to really be strategic with how you study, just so you can make that free time for yourself.
And another question I have is you mentioned that you're doing your clinical rotations like that right now. How much freedom do you have in the type of setting you go to?
So it depends on the setting. So basically, some clinics, their documentation system is like you need to be there on a T. If their patient scheduling is more of like a PT mill, you're basically not going to have a lot of time to document in between patients or sessions. And so after an 8-hour day, if you haven't been able to do your notes, you're basically, trying to get those notes done, but also not be under malpractice. So your days could turn from an 8-hour to a 12-hour if you aren't careful and if you aren't efficient with your time. So that's usually in the outpatient setting. In the inpatient setting, though, those patients are usually ranging from like 4 to 8. So pretty much one on the hour. In the outpatient setting, it's like 14 to 18 patients per day. And so, if you have 18 notes to do and you have to be thorough with all of them, like that's when it could like really, really stack up. But with the inpatient setting, my days right now, because I'm in outpatient ortho, but it's basically like kind of like inpatient because we only get like 8 patients a day. But my days are usually 8 hours. I get like 30 minutes and then like I'm pretty much done with notes, just because I gotten more efficient with it. So during clinicals in PT school, that's when you have the most time. And then that's just because you don't need to learn anymore. You're just, following through with everything you've done and just making sure that you can just clean up any of your information that you've been putting out. Where are you guys on your journeys for PT school or just pre-PT?
I'm in my third year at Long Beach in the exercise science program. And then I plan on applying after I graduate.
Nice.
I think I'm planning on taking a gap year at the very least, and then applying for the next cycle in 2023. I think.
Nice.
Yep. I think by then, or at the end of that gap year, my classes are about to expire, and then I can just I just get it right before. Anybody else?
I'm barely in my second year.
Hey, nice.
Yeah.
About Roger Sicily? I hope I'm saying it right.
I'm in my third year and I'm actually in a different major, so I'm just here just to like get some new insight.
Cool. No, that's cool that you're in a different major though. Are you still thinking about doing PT?
Yeah.
Nice. That's actually like really unique too, because I have some of my friends in my cohort, and they're like sociology majors, dance backgrounds. So it really doesn't matter where you come from. Being able to bring that outside knowledge to the setting can be really beneficial. And then Jaime, are you thinking of going like just straight into PT school afterwards?
Yeah, that's kind of the plan.
Mm.
Or at the least applying right afterwards, because I know a lot of people don't usually get in their first cycle. So I just kind of just want to give I just want to give myself as many chances to get in as I can, really.
Yeah, that's good. That's good. Yeah, and it really it's kind of weird too with PT school because like our program at Long Beach, it starts in the summer, and with like St. Augustine or any of that, those start in the fall, and so just really looking into when they start can really be beneficial because sometimes too there's like other schools where you have a week off and then you start PT school after you graduate, and it's like, geez, it's crazy.
I remember you mentioned something about burnout earlier, Charleston.
Mhm.
Um, have the multiple locations that you work in and like your hobby of art also helped you manage that as you got through your PT degree?
Yeah, definitely. Like through the didactics or like the academic portion when you're just studying all day, I found like exercise really helpful, drawing really helpful, just so I can like get my mind off of PT to do something other than, the profession itself, just because, you got to give your brain what it needs besides just, filling with information. So those definitely helped out a lot because I probably went through like more cycles of burnout than I would ever have wanted to. And with PT school, it's super hard. Like, and it isn't hard because the information itself is hard, but it's because you start off with the ground running and they throw a lot at you, and you just got to figure out for yourself how you're going to manage. You definitely have friends while you're in the cohort, so you all try to manage together, and so that's really helpful. Um, I think when I first started PT school, I think we were taking like in the summer like 5 classes and like 2 labs, and that was a 8 week, I think, like 12-week course because it's in the summer. So they like run information at you. And then in the fall, it's like 8 classes and 4 of them being labs. So yeah, it gets hefty, but you have friends in the program that help you study, and it really gets beneficial just to have study groups and everything going on.
Do you guys have any courses that you have to take in your third year while you're doing clinical rotations, or is it just the rotations?
For Long Beach specifically, it's only the clinicals during our third year. But I know for APU or Chapman, they have classes within their third year as well. So basically, I have a friend right now in the clinical I'm at, and right after they get off of the clinical, they have to go to like a class. And so I'm like, oh my gosh, that sounds rough. But that's how it is in some programs. That's why I specifically like Long Beach's, just because it seems so streamlined. It's like you learn basics first year, you're trying to apply now in your second year, and then you're just following through on your third year.
Are there any specific specialties that you're interested in that you wanted to go into after school?
Definitely. So I learned that I really like the ARU setting. So that's the acute rehab unit, or they're also called an IRF, or an inpatient rehab facility. That's basically if a patient just suffered a stroke, or if they had this massive surgery and now they're like pretty much they can't really move, they would go to an ARU to basically do a boot camp of walking and mobility. And basically, if they went from bedridden at the end of 2 to 4 weeks, they'd be walking, just to speed up their process of getting back to where they want to be. So it was really cool seeing a lot of progress in so little amount of time. Also, their documentation is not very heavy. So that's what I'm really hoping to get into now. I didn't think I was going to like inpatient when I first started PT school. I thought I was more of an ortho type of guy, but I've changed because it seems so cool to see like so much progress. And you're just there, to help them in that very, very first amount of time when they're like going through a surgery or something.
how much freedom do you get to choose like an area of interest for yourself during your clinical rotations?
So it depends on the place you go to. For Long Beach, you basically make a list of 10 or so clinical rotations. And the clinical rotations, you probably don't know who is where. Kind of like I've never heard of Tustin Rehab. Didn't know who that was, but they label if it's like outpatient neuro, if it's ARU setting, outpatient orthopedics. So they tell you which settings are in the place, and then sometimes they have little tidbits of information of like CI is really good, or like make sure you know your anatomy or something like that. So you are able to get a preferred list. From there, it's kind of like a drawing, just because the clinic might not have enough slots, or they already filled that slot. And so you basically go through your list of 10 and hopefully one of them hit, and that's where you'd be going. For St. Augustine, though, I've heard that it's basically it's a drawing and it's out of state. So you can't have any rotations in state if you go to St. Augustine. And then I think that's about, and then APU, you can make rotations out of state. For Long Beach specifically, you can't do anything out of state. So it depends on what you want to do. If you want to get out far, far away from California, it's a little harder to do rotations at Long Beach. But I mean, I don't know if I could handle going to St. Augustine and having to be forced to go to a different state. It'd be cool, but I don't think I can front the money for that.
And then how from what you've seen so far and being in your clinical rotations and stuff like that, how much of a positive is the DPT degree, like in terms of financials? Because I know a lot of people go to like really expensive schools and then they're in debt forever and all that stuff. And other people say they don't make very much money into it. From what you've seen, is that more so the case, or is it more the pay is better than it seems? Like, how would you say?
So I always ask my CIs or my clinical instructors when I was out on rotations of like how much they were getting paid, because I was like, I do not want to work at a place if I'm like really like liking it and getting paid little to nothing. And so based on everything I've asked my CIs, outpatient ortho, it's basically one of the least paying settings of PT. He was making, I would say, he was also the manager of that place. He was making like 38 an hour, which is, you know, not the best for PT. It's like about like 70K, 75, I think, if you put like that hourly into a yearly. So if you want to go somewhere and make sure you pay off your debts, I would recommend going like the inpatient setting. So that's another pull of why I like the ARU, because basically their like starting is usually like 80 to 90. And yeah, make sure you stay away from outpatient ortho to start off with if you're trying to do it for the money. The ones you want to get into in the long run of things, to make sure that, you know, if you're seeing PT as more of a financial benefit, is to do this thing called home health. And so home health PT is basically an inpatient type PT, but you'd be in the patient's homes. So these patients just came out of the ARU and now they're getting continuing PT to make sure that they can, you know, go back from an injury, and they're still, you know, needing help with like toileting, or they need help with walking around. It'd be a lot of like general exercise. The documentation's a little, it's not the worst, not the best, but their salary is like most of the time more than 100K, like starting. It's just hard if you're going to be doing that as a new grad, because you have nobody with you. It's just you, and you're just going to these patients' homes.
That does remind me, because we had I had my uncle who actually spoke for our club at one point, and he was home health, so he was telling us a little bit about that. So okay.
Yeah, home health is where it's at. And sometimes too, like my CI right now, she does home health on the side, and she does it through like a third party. So somebody who was a PT made this like group to, she had so many clients, and so she was just distributing it to other PTs. It's basically like a cash-based system. And when it's cash-based, you don't need a document. And so that'd be like the best type of thing to do. It just takes a lot more effort because you're basically like a small business. But yeah, like, my friend who went to APU, or no, my CI too, she went to APU as well. But I don't know, I'm just being completely honest. It's like, it's crazy because, she has been working now for 6 years. She's still paying off her debts, and she's going more towards the route of loan forgiveness. And the way you can do that as a PT is if you work in a hospital setting or somewhere that's if it's like a charity or something with a community or something. I don't know what the specifics are, but if you work for somewhere for 10 years, you're pretty much have an opportunity to get your loans forgiven, which is crazy though, because it's like if she was, out of school, it would be easier for her to get loan forgiveness than to pay off her loans in 10 years. So that sounded like a lot of loans from APU.
Yeah, the loans are actually one of the biggest things I'm worried about when it comes to not just graduating from PT school, but also like just with the bachelor's. Because my main concern is if I can pay off the rest of my student loans before I apply to PT school, like would it be any better? Or if I just tacked on more, would it be harder to pay off? So
Yeah.
it's just something we'd have to run into. I mean, I plan on getting them done by the end of this year, but it hasn't. Was it a difficult? If you're okay, if you're comfortable with answering it, like, is it has it been of a similar difficulty for you to pay off the student loans as you're even with the jobs that you have?
It's been better. It's been easier, but I think at least right now, I mean, if you're gonna pay off the loans from undergrad as well, I feel like the only risk of holding off on paying them would be just the interest involved. But I know with pandemic and everything, like it's been pretty much a pause, which is really nice. So making sure you put that into account would be definitely really beneficial. Long Beach though, that one's the best. All right, bye Karen. But definitely Long Beach has one of the most inexpensive tuitions through all the PT schools, that one. And so basically I would recommend going to either CSUN or CSULB, some sort of Cal State, because then there are opportunities for grants in the Cal State system that pretty much a private doesn't have to help you with paying off that tuition.
I heard a little bit about the grant thing from when it came to Long Beach's program, but I didn't know that there was the same for CSUN.
Yeah, I didn't know that either until some of my friends were talking about it. And so yeah, they definitely get the same same benefits.
Yeah, one of the places I was looking into for applying was Baylor, because I heard they had the it's a tuition free thing, but you give you give active duty service for 6 years in the Army. So that's just been on the back burner, but and it looked like the requirements to get into it were approximately the same as it would if you're trying to get into something like I guess anything except the Cal State Long Beach. And I think the requirements actually changed in the last year. So I think I might still keep looking into that.
Yeah. I know Fresno State too would be an option as well.
Okay.
And then also too, I think going into PT school, each school has their own little like specifics and things that they really highlight. So for Long Beach, they highlight their neuro, like their, ability to teach their students neuro, and like basically that's about like strokes. We have a neuro clinic on campus, and that's what we pretty much go through our second year. Fresno, I think it's more ortho. Same with St. Augustine. They do actually, St. Augustine, they focus a lot on soft tissue and manual therapy. So depending on where you go, that's what they might be more focused on teaching you. So, sometimes when you're in clinicals, you're like, oh, why didn't you learn this? And it's like, oh, our school didn't like focus on that. And so that happens a lot, but that's why clinicals are there, just because if there is something that you weren't well-rounded in through the academic portion of school, clinicals help pretty much shape you out.
So I was actually going to ask you, is there anything else sort of like that, like how Long Beach focuses more on the neuro aspect of PT? Are there any other things that you didn't know before you started the program that you wish were a little bit more promoted or obvious?
Promoted through like the undergrad portion?
Like through the undergrad portion, or even like the information section sessions that they host every once in a while, or their school website?
I think, well, actually, since I've started since I finished undergrad, I feel like they started doing a lot of goniometry in some of the kin classes. Correct me if I'm wrong. Like for biomechanics, I saw people doing like some goniometry with like knee flexion angles and whatnot. When I was in school, we didn't have that at all. So I think some of the classes might be geared more towards PT now that I don't know. What are your takes? What have you learned so far in undergrad that are kind of PT-esque for you guys?
I haven't gotten to take many of the kin courses yet, because this is my first semester as a declared kin major. So I don't get to take biomechanics until next semester, actually.
Gotcha. Okay.
So I haven't had much overlap really yet.
I see. Yeah, you might feel that overlap finally once you take some of those kin classes. They do a really good job with exercises and making sure that you can periodize, especially with that 462 class. Strengthening phase, motor control was a really good class. It was a really good base of knowledge once I got into PT school, because that's basically how you train people and how you can effectively communicate to them to make sure that they do what you want them to do. I think undergrad gives you a really good base, and then you learn a lot more of that neuro, because we don't learn any neuro, I feel like, in undergrad.
I happen to agree with that. Neuro is kind of a fleeting thing until you take even was it a kin 430, which is motor, like the more specific motor control thing. There wasn't too much. It went over like pathology and how those are managed.
Yeah.
But I feel like there wasn't enough in that class to pick up besides that.
Yeah.
For screenings and all that, that seems to be coming more from kin 405,
Okay.
surprisingly. So they have us working with the PAR-Qs and like safety and data sheets. But like the first taste of like a goniometer at any point, I think, was with 441, which is the applied biomech.
Yeah. Even when I had that class in applied biomech, we still didn't do we did more of like center of mass and like lever arms, just trying to make sure we can like figure out where the center mass of a portion of the body would be, type of thing. So yeah, so that's good that you guys get it now. I think another thing that I was thinking of that might be beneficial would be taking a supplementary class about pharmaceuticals, or just knowing like the end terms, like the ENs for like specific type of medications. Because we learned that in school for PT school, but I know there was some classes, like I took one class, it was called like medical abbreviations. It was like a small like 1 unit class when I was in undergrad, and that helped me at the time. It's just making sure that you take those notes pretty well, and so you can remember them once you get into PT school.
Yeah. Okay. I just remembered there was actually a class I took that I think was the closest to PT that you could get as a, assuming that you can get, you're already a declared major, you're already declared into the exercise science major. It was athletic training 207. And that one was actually I think the first of any of my classes that I actually talked about evidence-based practice. So I don't know if it's still open to undergrads, because there's been some changes with the athletic training program, but I think that was the closest that I ever got to anything related to MSK care, at least.
That's cool.
Yeah. The teacher was great too, so highly recommend that class. Anybody got any other questions?
I don't think I have any more.
I have some like closing stuff if we're ready for that portion, but I'll leave it open for now if anyone has any questions.
Oh, I actually did have another one. I saw on Long Beach's website that they have like a orthopedic residency program for after you graduate. Have you heard anything about that and how that would work?
Yeah, so the orthopedic residency is really cool because it's basically at PT at the beach, right by the Life Fit Center, kind of by the rec. So that orthopedic residency, it's basically like you have to apply for school all over again type of thing. Usually it's more rare for more than 20 applicants to apply, just because residencies aren't really required yet for PT. It's more of an advanced education just for your own self-benefit type of thing. The orthopedic residency is geared towards allowing you to take the OCS, which is the orthopedic certified like specialty, just to say that you are a specialist in the orthopedics with advanced techniques and most evidence-based practice. It's with the PT, his name's Dr. Miller. He teaches some of our classes for the doctor program. Very, very beneficial, very, very helpful. He's a very smart guy. I would say you don't really need to take the OCS unless you really want to. The information he would teach you in the orthopedic residency would be enough just so you can basically have a good leg up once you start as a new grad. The residency is basically like I think it's a 9-month type of pretty much schooling, and you're basically seeing patients for the whole time with a very experienced clinician watching over you, while also studying for OCS type material. And he would just basically critique as you go along to see how you're doing and how you can improve.
Okay, cool. Thank you.
Yeah. I have some friends that want to take that residency now, but yeah, again, residencies aren't required. It's just a way that you can continue learning if you decide to do so with someone helping you. Because if you don't, then basically once you're a new grad, you're just learning as you go from either the PTs around you, or if you go to a specific clinic, you could ask them if they offer some sort of mentorship. If you're not doing that, then you just do MedBridge videos of how you can like continue to learn specific techniques that you're not really familiar with. So once you graduate, it's a lot more of trial and error by yourself. And that's when that's why people do residencies, just so they can feel a little more confident with very advanced techniques. So there's like an orthopedic residency, a residency in like the neuro specialty, peds. Basically, most settings they have a residency. It just depends on where you go. And also one thing is, most residencies, they actually pay you during your time there. It's not going to be like a crazy amount, but it's going to be enough so that you can like get by, because you're basically, doing work. So the whole thing would basically be paid for. But if you do decide to take the OCS exam afterwards, that thing is like 8K, I think, for just to take the exam. It's pretty high. And you have to like renew it every 10 years. So yeah, it's just more letters to your name, but it gives you, I guess a little more confidence if you can say you did it. But yeah, a lot of just self-benefit.
All right. I if anybody did anybody have any more questions? Cicely, you got nothing? Do you have anything?
No. Questions?
Okay. I think I'm good on questions too. So if you want, Charleson, we can wrap it up now.
All right, I'll just do a little wrap up of like, I think we covered a lot of the bases of what I was gonna say for these like little takeaways that I've been thinking of just for you guys. But basically, when it comes to PT, you really should find your why. And that just means that, if a patient asks you, oh, why did you, choose physical therapy? Because I get that a lot. And when you just say, oh, it's just a thing that I wanted to do, it kind of doesn't give the patient some confidence that you're there for a reason. They kind of want to know what your passion was to get to this point of getting your doctorate. And so for me, it didn't really come in like a snap of like, oh yeah, it's because I went to PT. A lot of my friends, like their stories, like they either had a PT session or they had an injury and that brought them to physical therapy. For me, it was more just like my coaching background and anatomy that really solidified like my want and need to teach others in an exercise setting. And so, just find it within yourself and do a lot of self-reflection of why you want to be in this profession, not just so you can tell patients, but also because there's going to be a lot of hard times when you're like, I'm so burnt out, I don't want to do this anymore, I just want to make money. In anything that it doesn't matter what it is. So just, make sure you know where that solid why is and why you are there, and stem that to your passion. Next thing is like, build on your hobbies and passions. So like mine was like art. Sometimes you can make that into something as a little side business. For me, I have a little bit of like an Etsy page, just so I can like sell some stickers that are related to my anatomy that I do, or just learn. And so making sure that you have that little bit of that outlet so you can prevent burnout, but also use it to your advantage when you're applying to PT school, because people just don't want to see I was a aide for X plus years and I have now done my volunteers like hours and I went here for undergrad. Like they want to see you more as a person. And so if you can build on those hobbies and passions, like that puts you into an advantage of who you are and what your character is. Because I have a lot of patients who are like, oh yeah, I used to play basketball or blah 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 blah, and like learning and knowing specific activities and drills can help you make exercises more fun and more engaging for patients, just so they would take those exercises home once they leave. Another thing is definitely plan your day hour by hour if you're feeling overwhelmed. In PT school, like I said, like you can take like 8-9 classes at a time. So midterms and exams are always stacked up over each other, and making sure that you can do it all, it takes a lot of like concentration to be like, all right, I need to do this on this day. Like if you saw my calendar, there'd be colors everywhere, just like exams and tests and studies and all of it. So make sure that you can pretty much organize your day. If you keep it in your head, you just start getting confused. So make sure that you can either have a planner or use like Google Calendar or something to make sure that you stay on track. Another thing is to write out your goals to make sure you're accountable. So for me, I was burnt out a lot of times. And when you're burnt out as a student, it doesn't really matter that much. You're just going to either get some exams lower scores or whatnot. When you're burnt out as a therapist, you start making mistakes for the patient's sake. And that is not good because those people are there, they're paying their money to make sure that they can walk again. And if you're burnt out and you're not really there for them, like, I would feel very bad to say that they're my therapist. So make sure that you keep yourself accountable. And even when you're burnt out, make sure you are finding why you're there. We talked about flexible jobs. If you are going to get a job in PT school, make sure they know and that you know how much you're going to give to them. So I always ask my jobs was like, I'm going to be working this many hours because I need this much time to study. And I'll promise you to increase my hours as I get used to the studying and the transition of working and studying. And if they are like, no, we need more hours, like that's not the job I want to take. So make sure you're pretty much solid and set on your boundaries of how much you want to work. Because a lot of times PT and PT students there are a lot of like just people pleasers. And that was me. And so make sure you know when to say no to, others, friends, parties, hangouts, and definitely say yes to a lot of things that make you happy. It doesn't matter what it is. Could be basketball, could be, doing handstands for all I care. Like just something that makes you feel better. And if you're just saying yes to people just to make sure that they're happy, that's not going to work well for you in the long run of things in PT school, most especially, but in life in general, because that's your time. We talked about learning styles and yeah, definitely time management. But those are all my goals for you guys to hopefully, set yourself and be mindful of everything. Good luck with all your classes that you're going to be taking for PT and eventually applying for PT school. If you ever need anything from me, I'll put my, I should have put on here, but I'll put my email in the chat, but definitely that's it. Oh, yeah,
All
this
right.
is something I'm working on, but yeah, that's it.
I'm probably gonna buy a sticker. If that becomes a sticker, I'm buying that. I'll buy it. All right. Well, thank you again for being willing to be a guest speaker today, Charleson.
For sure. Yeah. Thanks for having me.
Yeah, no problem. I'll see you tomorrow.
See you tomorrow.
Thanks a lot.
Yeah. Thanks, Jamie.
All right. Bye.
Take care, everybody.